Tim Black, education formally. Got my bachelor's at BYU in Spanish translation and English to a job that, well, it was just really one job in mind. I'm looking over there. I gotta stop looking.
Whatever.
And didn't want to go into that career, so went back to school, got my master's in public and health service administration from the University of Utah.
And where do you work now?
Currently work at Timpanogos Regional and Lone Peak Hospitals as one of the administrators up there, handling specifically all of the human resource, leadership, and organizational development functions.
Great. What do you now do?
Well, back before I got my bachelor's degree, I thought I wanted to be a doctor, but realized that I had a hard time disassociating the pain from, and specifically a pediatrician. But then I volunteered in the emergency room at a hospital for a year and realized I didn't want to be a doctor, but still went for a period of time after I got my bachelor's degree, and my other passion in life is building. I love building, woodworking, and that. So built a couple of homes, enjoyed that, but was not entrepreneurial in spirit and really risk averse, to where I decided that I needed something more stable. So as I talked with my wife, we looked at different options, and I went back to healthcare, thinking, well, what is there in healthcare? What do I enjoy doing? And knew I didn't want to be a clinician, but loved to be a part of an organization or a career path that helped others that couldn't do things for themselves. So went back to school to get into the administrative side of healthcare, and that's where I'm at.
Great.
And so those are things that in my job I get a lot of satisfaction with, because I help develop those programs that get people thinking on a level that they understand that, you know, no one is any more or less important than the other, and check on how they're doing. But I feel like I make a difference more indirectly in that I hopefully have an influence over some of the employees and what they're doing and how they take care of patients that will then have a positive lasting effect on them. Long answer to specific. Do I affect people? I would like to think so.
That's great. You do best at your job?
People interaction. Getting to know people, remembering people. I think a number of years ago I had a great mentor who said that the most important words in any language are a person's own name. And so, being able to go around in my work and call people by name that I don't interact with a lot, and in some way help them realize that in my role, in my position, that they're known, and in some small way that someone from, in the C-suite, if you will, isn't just there trying to increase productivity and manage budgets, but are really looking at the people.
Mm-hmm.
Maybe that.
You mentioned.
I think it's, if I were to say what I'm most passionate about is the idea of retirement and spending all my life with my family, but until I win the Utah lottery. But really, what I'm passionate about is taking a group of people who may or may not be friends, giving them a common goal, if you will, or a perspective to look forward to or work toward, and then see how we can remove the barriers and achieve the results that will make everyone better than we were before. So a lot of challenges in healthcare work. Some days is tough, but most of the time there's a lot of fulfillment from.
Great. Mentors? What role have mentors played for you?
I'm not very smart, and I don't say that to be humble. I'm just not that smart, but I rely on people who get it. And there's a lot of people I've met. I mean, I had a CEO who was one of the smartest people I ever met, but I didn't learn a single thing from that person. I knew they were smart, and that was it. mentors to me are the ones that get it and they understand how things work and they understand people, and then make me want to use or tweak what they've done to improve not only how I do my job, but how I interact with people who either can affect how I do my job. Who is looking to be in any type of leadership role, is that there's a lot of managers in the world, probably too many, what the world needs, and I think every facet or every, what's the word I'm looking for? Independent of the industry or the public or private sector, I think that there's too many managers, not enough leaders. And I think that if I could encourage anyone is, don't go into a position thinking that your goal is to be a title, and that title involves being a manager or a director or a CEO or whatever. Go into it saying, okay, what can I do to be a leader?
If you
I
have
found
it,
that,
not
again,
don't
like
worry
those
about it.
mentors what I want people to know, I think it's all about people. If I were go Cougs.
Yeah. So where are you working?
We're good.
Interview with the door. Take one.
Yes, it's been on for like 30 seconds.
We'll make sure to put that out.